Good evening, doctors. Welcome again. This is our UPSC Medical Services exam part 6th of MCQs. So those who are not watch still part 1 to 5, so go and watch on my playlist. And this is for those who are still watched already part 5. Now, jaundice in newborn is physiological when the total bilirubin concentration in the serum increases by 1 milligram per deciliter per day. This is answer. Now, a term baby was born with complaints of breathing difficulty. He was born normally to primigravida. Mother, antenatal period, and labor record were normal. On examination, he was in respiratory distress. Abdomen was flat. There was no organomegaly. What is the most likely cause here? Here, the most likely cause is diaphragmatic hernia. So, answer here is diaphragmatic hernia. So, hope till here it's clear. Now, the fetal length is affected if the mother has undernutrition during the any time during pregnancy. Okay. Now, a 26-year-old third gravida mother delivered a male baby 4.2 kgs at 37 weeks of gestation through emergency cesarean section for obstructed labor. The child developed respiratory distress 1 hour after birth. He was kept nil per oral and given intravenous fluid. He maintained oxygen saturation on room air. On antibiotics were given. No antibiotics were given. Chest radiography revealed fluid in interlobular fissure. Respiratory distress settled by 24 hours of life. What is the most likely diagnosis here? See, guys, all four options in front of you, and answer here is transient tachypnea of the newborn. This is the transient tachypnea of newborn. Okay, sorry. Bag and mask ventilation in newborn resuscitation is contraindicated in case of diaphragmatic hernia. In case of diaphragmatic hernia. Now, cephalohematoma usually disappears within 5 to 7 years. Which one of the following is true of transient tachypnea of the newborn? See, guys, all four options and carefully. And the answer here is onset of respiratory distress is immediately after birth and it rarely lasts beyond 48 hours. Okay. Most common newborn rash which present at 24 hours to 48 hours of life is erythematous papular postular lesion. Erythematous papular postular lesion. Now, very low birth weight babies are less than 1500. Low birth is less than 2500 gram, and extremely low is less than 1000, and between 2005 to 3000 grams is normal. Okay, now in a newborn, what is the normal respiratory rate? That is 30 to 40 breaths per minute. The newborn rate is about heart rate is about 120 to 160 beats per minute. Which one of the following is true of hyaline membrane disease of newborn? Hyaline membrane disease of newborn. See, guys, carefully. Prematurity provides relative protection to occurrence. Maternal steroid exposure increase severity. So answer here is phosphatidylglycerol estimation is reliable methods of diagnosis. Okay, now which one of the following is not a characteristic of vitamin D resistant rickets? That is X-linked inheritance, renal stones, but reduced calcium absorption from gut. It's not true. So this is the answer here. Now, abnormality of copper metabolism are implicated in the pathogenesis of all of the following except Kishan disease. This is not implicated in Kishan disease. Now, Rett syndrome occurs due to deficiency of biotin. Which one of the following vitamin deficiency causes corneal vascularization, poor growth, and photophobia? It is due to riboflavin. It is mainly due to riboflavin. Okay. Among the following, the best indicator for acute malnutrition in the under 5 is weight for height. Remember, in an infant and toddlers, craniotabs is a sign related to the deficiency of vitamin D. Okay. Now, the triad of diarrhea, dementia, dermatitis is characteristically seen in deficiency of which vitamin? In niacin. Endemic cardiomyopathy in children is linked by the deficiency of mainly selenium. Okay, now when can a severely malnourished child to be safely discharged from hospital? When a child loses edema and he starts gaining a weight. With reference to malnourished child, what of the following statements are correct except skin mucosa not effective barrier of infection, there is impaired chemotaxis association defective, candicidal bactericidal capacity of polymorphs, there is impairment of cell mediated immunity and delayed hypersensitivity, there is impaired of humoral immunity, immunizing cell reduce the number of beta cells. So you have to do this answer by your own and write in a comment box what is the answer here. So guys, this question I leave for you, and you have to be answered by your own. Think what is the best answer here, but now I decide to give you answer. It is answer is there is an impaired humoral response to immunizing agent and reduces the number of B cells. So guys, have a good day. Goodbye. That's all for today. If you like this video, put like on it, and if you have any comments and queries, you can ask me. And if you still not subscribe my channel, please subscribe it. Thank you. Good day and goodbye.